Tell us about these shortages you're facing when it comes to medication.
Sure. Thank you, Sarah, and thanks for having me back. You know, the drugs that we're talking about are drugs that are used in ventilator care. They're drugs that help people be sedated. They're paralytics that allow the extubations to occur. They're things that keep airways open, and they're things that manage blood pressures. Those are absolutely critical in this equation. And yesterday, we got some really great news. So we rang the bell on this over the last week. Part was media, and we also had a direct letter to the DEA from the American Hospital Association, the American Medical Association, a group of anesthesiologists, and a couple of other associations. I got to tell you, I really saw government work quickly then, because yesterday they came out with a ruling that they were going to increase production limits. They were going to allow that to occur because that is regulated, and they were going to allow imports to occur. So we're thrilled that the government took that kind of action. And now what remains to be seen is how quickly the drug companies are going to mobilize and begin manufacturing these drugs, these essential drugs, and how they are going to get those to the areas that are most in need right now. Because as you have referenced in some of the conversations that you've been having this morning, that the uptake of this virus is uneven throughout the country right now as it migrates. And we are absolutely in the hotbed here in the greater New York metro area. And, you know, my hospitals and doctors' offices start one stop off the train line out of the city into New Jersey.
So what do you need right now? Do you have the ventilators? It sounds like you're going to get access to the medication, or at least this development will help on that front. PPE, tell us what the needs are at this point.
Yeah, so let me tell you how this chain works. And when any link in this chain is broken, it hurts the entire healthcare system. It all starts with testing, and we've talked about that a number of times. That has gotten better, but it is not where it needs to be yet. We need to have that testing at point of care. There's been a lot of discussions about that, but we still haven't seen that in the field, particularly in these high areas of high need. The second is protective equipment. That's connected to the testing, because if we don't know which patients are absolutely positive, that means that we have to protect our caregivers from all patients that have any of these symptoms. And in general, you know, about half of the people we test end up not having the virus. Therefore, we burn through half of the protective equipment, which is of low supply and continues to be. For example, each patient requires about 20 sets of protective equipment for our team members per day. It's a big number. The third is making sure that we've got the physical capacity. We have decanted our hospitals from anything elective or non-urgent. We have, in essence, converted our hospitals to primarily COVID areas, although about 25% of our activity still sees other types of patients because illness goes on. And we've also increased our ICU capacity in some of our hospitals ×3. Using areas that are like post-anesthesia care areas or ORs. The key thing there are ventilators, because most of the ICU patients, which is about 35% of the inpatients now that have this virus, need ventilators. Those ventilators are coming to us through a couple of different sources. One is through the federal stockpile, and Governor Murphy has been working that so hard for us, and he's just doing a great job, and we've received a lot of those ventilators. The other is by redistributing those ventilators from other parts of the state, and we've got great cooperative work going on between our health systems. But the third is pleas to family and friends in the healthcare field. And I got to tell you, I'm thrilled that our friends at Johns Hopkins or Carilion or CHOP and WellSpan Health all helped us out in a time of crisis. So we're tweaking by as it relates to vents, but this piece of medications is so important, because imagine having to have surgery without an anesthetic. That's what it would be like being on a ventilator without these important drugs.
Brian, Jim Kramer, thank you for coming on, and thank you for Overlook, which is a hospital that's about a mile from me that we support and summit every day. and I've supported for what they do because it's just a great hospital. When we talk about ventilators, we hear mixed things. I thought that, geez, a ventilator give a person a fighting chance, but then Governor Cuomo said that only about 20% of the people on ventilators live. Now, look, we want everyone to live, so maybe that's a good ratio, and I don't know. But is there any hope that if you had everything right, that it could possibly be more people survive?
You know, clearly making sure that we've got access to ventilators and we've got the right medications are an important part of that equation. You know, your observation about ventilator care with this patient population is really interesting. We are seeing on average lengths of stay 12 to 18 days. And over this past week, it was Saturday night, for example, I got an email at about 11 o'clock at night from one of our hospital presidents. They had their first extubation, meaning the patient was taken off of the ventilator successfully breathing on his own. And that required a celebration at socially appropriate distance of our team members in order to do that, because it's such a rare occurrence. Now, this past week, we have been seeing more successful extubations. I think at our command center yesterday, it was reported that we had 12 overnight, but that clearly is a problem. And as we're looking at our data, we're seeing some very troubling things.